So this is the few question about the critical care. So a client is being went from parental nutrition and also expected to begin taking the solid food. The ongoing solution rate has been 100 ml per hour. So you see the solution flow rate 100 ml per hour. The nurse anticipate what that which prescription regarding parental nutrition solution will accompany diet prescription. So a patient already taking the parental nutrition. So parental nutrition often it is called total parental nutrition. So now patient want to or move to from parental to the solid food. So, but my question is here, the during this parental nutrition, what solution accompanied with the prescription? So now here is this what they said, discontinue the PN means parental nutrition, decrease the parental nutrition rate to 50 ml per hour, start the normal saline at 25 hour, and continue the infusion rate prescription for PN. Continue the current infusion. So, my friend, this is very important to read the examiner, what they want, and also we have to have a very clear sense about the information. So keep in mind, when a patient is undergo the parental nutrition, we do not suddenly discontinue it. Not, I said. Why? Because patient chance to develop hypoglycemia. When you give a patient or when you start a parental nutrition, you have to check the blood sugar because patient chance to develop hyperglycemia. But when time will come, you need to stop, but we do not suddenly stop. Also, in the same time, if anything had happened, you could continue the nutrition line that is not harmful for the patient. And also patient move on from parental to the mouth or liquid food, then solid. And by the time we can stop. So when time will come to stop the procedure, we do not take the action suddenly. Gradually we do this, gradually, right? So right now patient is here the question rate, flow rate has been 100 ml per hour. And I said not stop suddenly, gradually stop. Observe your patient. Patient develop hypoglycemia or patient okay with the solid food or not. So just reduce them. So out of 4, discontinue the PN. Suddenly we never do this, so it is not an answer. So patient already getting the total parental nutrition. What is the 100 ml per? So you see out of 4, decrease. So I said we have to slow down, reduce the rate. So it is 50% ml per hour. This is the half of this. So it is the continue and reduce. Then you can stop. So this is the good option to choose the answer. Start the normal saline solution. Why you start the suddenly normal saline? Already patient have one channel, parental nutrition. Continue the current. No, We do not, because we are observing the patient how body can respond, right? So the best option is reduce rather than suddenly stopped, gradually withdraw. What are the rationale? When a client begin eating a regular diet after a period of receiving the parental nutrition, so the PN is decreased gradually. So this is the note we learn, my friend. Let me recap it. When you start the total parental nutrition to a patient, we check the blood sugar. Why? To chance to develop the increase the blood sugar. It's called hyperglycemia. And same time, we have to clean out the channel because bacteria chance to develop. Why? Because bacteria love to the glucose, and parental nutrition or dextrosaline solution contain a good amount of glucose. Same when we ready to remove the patient parental nutrition or from parental to the mouth route for food, solid, liquid to solid. In this time, we could reduce the rate rather than suddenly stopped, right? So they said PN is decreased gradually, not abruptly. That's it. This is the note we learn from here. You do not need to memorize each and everything from here because you most of the information you already know. And what are the chocolate points from here? We can write down in a note. Next question here. What are the next question they said? So they said a nurse is preparing to change the parental nutrition. So the client's central venous line is located in the right subclavian vein. The nurse asks the client to take which essential action during the tubing change. So I said parental nutrition, sometimes we give the peripheral channel or central line. Basically, central line, we use subclavian arteries. So this is the preparing to change, right? The client's central line is located in the right subclavian. So there are left subclavian and right subclavian too. This patient using the right. So the nurse asking the client to take which essential action during the tubing change. So out of four, which is the most important? Because subclavian area is very important and very dangerous one. So you have to maintain everything, right? So first of all, it is very important. We have to know the technique or some maneuver is important when you're dealing with the patient, especially when changing. So they said breathing normally, turn the head to the right, exhale slowly and evenly. Number four, take a deep breath, hold it, and bear down. It is the procedure because one of the terminology important is called Valsalva Maneuver. So when patient like this, we need to dealing with them, always we have to follow the Valsalva Maneuver. What is Valsalva Maneuver? Valsalva Maneuver means we educate the patient, enforce them, take a deep breath, hold it, and then bear down. Okay, so this help to avoid some complication that tends to develop during tube changing, like embolus or embolism. If any ear embolism or any blood clot, it helps to prevent. So what we learn from here? We learn if need to change the tubing, we tell them to take a deep breath, hold it and bear down, and this is called Valsalva Maneuver. Why we do this? To prevent the complication. What complication? Like clot formation, ear embolism formation, like. So let me read the rationale. The client should be asked to perform the Valsalva maneuver during the tubing change. This helps avoid the ear embolism during the tube change. The nurse asks the client to take a deep breath, hold it, and bear down. If the intravenous line is on the right, the client turns his or her head to the left, and this position increases intrathoracic pressure. But most appropriate is follow the Valsalva maneuver. A client with parental nutrition and infusing has disconnecting the tubing from the central line catheter. The nurse assesses the client and suspect the ear embolism. The nurse should immediately place the client which position, very common, right? So a patient central line. So parental nutrition infusion has disconnecting the tubing. So disconnecting, what we should do first? Always we have to keep some sterile gauze space, put it up there to prevent the ear embolism, right? Central line, the nurse assess the client and suspect the ear embolism already there. Then what should do? What are the immediate place? This question is so easy. Examiner make it easy for you. So already mentioning the patient is remove it, disconnect it, ear embolism develop. Then what is immediate plan to place the client, which position to good for them, right? So there are four options. On the left side with head lower than the feet. So you see head lower than the feet. And this is called Tandelbach posture. So feet is up, head is down, so that the circulation will be stopped. So circulation will be up. The left side and head higher than feet. On the right side, the head lower than feet, or right side head is higher. So I said in that scenario, always left side. The first choice is left. So 1 and 2 is left. And secondly, head should be down, feet should be up. So this is the Tandelberg posture, our choice. So rational said, ear embolism occur when the ear entered the catheter system, such as the system is opened for intravenous tubing change or when IV tubing disconnecting. Ear embolism is a critical condition. If it is suspected, the client should be placed the left lying positioning. Head should be lower than the feet. The position is used to minimize the effect of air traveling as a bolus to the lungs by trap it, right? So, my friend, if when you work in the hospital, if any incidents occur like this, what we supposed to do? If ear embolism developed, we could turn the left side and Tandelberg positioning. So the air bubble does not traveling into the cerebral circulation, right? So it is the information we learn from this. So if we get any patient, we can apply it for them. So another question here, the nurse action, which nursing action is essential prior to initiating a new prescription for 500 ml of fat embolus to infuse 150 ml hour. So again, I want to read it. They said, which nursing action is essential prior to initiate a new prescription for 500 ml of fat embolus to infuse 50 ml per hour. So flow rate 50 ml per hour, right, is the flow rate call. And doctor said, or prescription say 500 ml fat need to infused, or emulsion need to put inside. So if the question like this, what we have to do? So always you see fat embolus. Not only this question, any kind of medication like antibiotic, any particular medication before or vaccination, before prepare your patient, always ask a common question. They have any history of allergy? So allergic history is important. But here it is particularly mentioning the fat infusion or emulsion need to push. In that scenario, we could ask some particular type of allergic. What else? Let me read the four options. They said, ensure that the client does not have diabetic. It does not matter about diabetic. If too much fluid infusion, that times it would become the question about the diabetic. Determine whether the client has an allergy to eggs, or add the regular insulin to the fat emulsion using aseptic technique. Also contact the healthcare provider to have a central insertion for emulsion. So out of these four, allergy to the eggs is very important. If patient need to infuse the fat, right? So in that cannot, it is the answer. So as I told you, if you check in my immunization lecture in my channel, you can see in particular type of vaccine, you need to know the patient do not have any allergy to particular materials. So in that scenario, let me read the explanation. The client beginning infusion of fat emulsion must be first assessed to known allergy to the eggs. Why? To prevent anaphylactic reaction. Anaphylactic reaction is a type of allergic reaction. It leads to the anaphylactic shock. So that's it from this question. What next? So the question said the nurse monitor the client receiving the parental nutrition for complication of therapy and should access the client for which manifestation of hyperglycemia. Very easy question, right? So I said when a patient need to take the parental nutrition, the parental nutrition contain the saline solution like 5% dextrosaline. So we can check the blood sugar level because it tends to develop hyperglycemia. So in this question, examine made it easy, already mentioning the hyperglycemia. So what are the sign symptoms of the hyperglycemia? The sign symptom of the hyperglycemia from parental or sign symptom of the hyperglycemia because of the diabetic, absolutely same. And it is NCLEX board like this type of information. I like to request, if you do not know the sign and symptom of hyperglycemia, don't go for the board exam. If you do not know the sign and symptom of the pulmonary embolism, don't go for the board exam. If you do not know the sign and symptom of DVT, means deep vein thrombosis, don't go for the board exam. If you do not know the sign and symptoms of meningitis, don't go for the board exam. If you do not know the all lab bellows, normal lab bellows, don't go for the board exam. NCLEX board is so easy, NCLEX board is so hard. NCLEX board frequently repeat or recap same question. So if you participate in my class or if you listen my recording, I believe all of the information I share with the student. So if you recap all of these materials, I believe it is more than enough to pass your licensing exam. So here, so what are the signs of hyperglycemia? Fever, weak pulse, and thirstiness. So I said weak pulse, thirst is okay, but why fever? This is no relation with this. Nausea, vomiting, and oliguria. Sweating, chill, and abdominal pain. So no chance to abdominal pain. Weakness, thirsty, increased urine output. So polyphagia, polydipsia, right? Polyuria, common sign, all started by P. So increase the urine output, it is called polyuria. Increase the thirstiness, polydipsia or polyphagia, or weakness. This is the most appropriate the sign of hyperglycemia. Let me read something more here. The high glucose concentration in PN place the client at the risk for hyperglycemia. The sign of hyperglycemia include excessive thirsty, fatigue, restlessness, confusion, weakness, small respiration, diuresis, coma, if untreated, right? So I want to recap it, my friend. They said excessive thirsty means, as I told you, polyphagia, polydipsia, polyuria, right? One of them, excessive thirstiness, fatigue, restlessness, confusion, weakness, deep respiration, and this is called deep and rapid respiration. It's called Kussmaul. What are the typical sign of diabetic ketoacidosis? Diuresis, excess P. If you not treated, develop to the coma, right? So that is very important. Every student should know. So next question is here. So the nurse is changing the central line and changing the center line and dressing of the client receiving the parental nutrition. And note that the catheter insertion site appear redness. Easy. So I said, this is the channel. So sign of inflammation is important. There are 5 cardinal sign of inflammation. Every student must know. And this is the common sign. Okay. Like temperature increase, redness, pain, right? So swelling. So the nurse should next access which item. So client temperature, expiration date of the bag, time of last dressing change, tightness, uh, tightness of the tubing connection. All is important, but which is the most important or most priorities, right? What are the sign of infection or what are the sign of inflammation? So here's the only one mentioning the inclined temperature. If temperature is increased, indicate inflammation or infection. This is the most priorities. So let me read it. The redness at the catheter insertion site is a possible indication of infection. The nurse should next assess for other sign of infection. So redness also one of the cardinal sign. Now next you see what are the other signs support for the infection. It is called diagnosis. For option given, the temperature is the next item to access, then tightness of tubing connection should be assessed too. Loose connection should result of leakage, not skin redness, right? So expiration date on the bag is a variable option, and definitely the RN when put it start the channel, she must check it, right? So when you read this question, just try to find out the clue linked what actually examiner asking you. So the next question here, this is the nurse is preparing a hem of fat emulsion. Fat emulsion means lipid, and note that the fat globules are visible at the top of the solution. You see, it is a chance of ear embolism. So, what as a nurse or LPN or RN, what we could do? So we always try to avoid the ear embolism and insert the circulation. So if we see something like this, definitely we have to stop or we have to choose the other option. Why we start something like this? The nurse should take which action? Roll the bottle a solution gently, obtain a defined bottle, also shake the bottle solution vigorously, run the bottle solution under the warm water. So definitely I said the defined clear one we should choose, right? There are 4 options. The 2 is the best one. Just change it. So what are the rationale? The fat embolism is a white opaque solution administered intravenously during the parental nutrition therapy to prevent the fatty acid. The nurse should examine the bottle of fat emulsion for separating the emulsion into layer of fat globules. right? Or for accumulation of food. The nurse should not hang a fat emulsion if any of these are observed and should return to the solution to the pharmacy. So the defective one which will not choose. The nurse is assessing a client peripheral intravenous site after completion of a vancomycin infusion, and note that the area is reddened, warm, painful, and slightly edematous, right, to the insertion site of IV catheter. So it is very clear and very easy mentioning that the sign and symptom of inflammation of the vein, and this is called phlebitis. So at this time, which action by the nurse would be the best one? So as I said, the IV means intravenous line. So intravenous line is pushed in the vein if the patient has complaint like redness, increase the temperature, warm, painful, tenderness, edematous, indicate the inflammation of the vein, and this is called phlebitis. At this time, what action should be the best option out of these four? Which one the best, right? So let me read it. Check the presence of blood return. Check the presence of blood return. Remove the IV site and restart the other site, and document the findings and continue to monitor the IV site. Call the healthcare provider and request that the vancomycin given orally. So you see, number 4, what said? It does not make sense. We are not doctor, right? So it is true that we can call or inform to the doctor. It is important. But what is my first priority? I am in the field, in the floor. Documentation also important. The process of it is the step-by-step process. But which is the first? First is your action. Take the measurement, stop the damage, call the doctor, keep the documentation, right? So out of all, first action to remove the IB because the already phlebitis is developed. So I have to remove the IB site, restart the another site, call the doctor, keep the documentation. So definitely our first priority to take action or remove it, start the new one. So let me read it. Phlebitis at an IV site can distinguished by the client discomfort at the site and by the redness, like the sign of redness, warm, swelling. So all of the sign of phlebitis, I said, right? Phlebitis means, it is see the phlebitis. Phlebitis means a condition of inflammation of the vein that causing the pain, discomfort, and swelling. At the same time, another terminology we could know, this is called thrombophlebitis. What is thrombophlebitis? Thrombophlebitis is also a condition where the inflammation of the vein and caused by the blood clot formation and affecting the normal flow of blood. So for NCLEX board, we must know what are the sign and symptom of the phlebitis. If phlebitis developed as a RN or LPN, what will be, what we should do, right? What is our responsibilities? So they said we could stop the channel and open the different site IP line and insert a new IP line at the different site, right? So next question here, they said still all of the question is here is parental nutrition related. So let me go second one. The nurse is preparing continuous intravenous infusion at the medication card. As the nurse goes to insert the spike end of the IV tubing into the IV bag, the tubing drops and spike end hit the top of the medication card. The nurse should take which action, right? So my friend, it is very important and it makes sense how to prevent the infection. If anything contaminated, we never ever push to the patient, right? So precursor is super important to prevent infection. Again, I said, if anything touch like this question means is um, contaminated, right? We must avoid it. We never use it to prevent the infection, because this infection can cause systemic infection, can lead to septicemia, and patient develop septic shock and die. So we never use it, right? Obtain a new IV bag, obtain a new IV tubing. Definitely it is, you see, IV tubing into the bag. So we use the bag is does not matter, but it is more appropriate tubing. Also, no, it is not spike or scarf, never. So it is the right. If we wash it, clean it, it does not make sense, right? So definitely we could use the new one. What is their explanation? The nurse should obtain a new IV tubing because contamination has occurred and could cause systemic infection to the client. And there is no need to obtain the new IV bag because the bag was not contaminated. The tubing is contaminated. So here, the client has received a transfusion of platelet. The nurse evaluates that the client is benefiting most from this therapy if the client exhibit which findings, right? So they actually asking the indication or benefit of platelet. What medical condition we use the platelet, right? The client is receiving transfusion of platelet. The nurse evaluates that the client is benefiting most from this therapy of the client exhibit of the findings. So I said the platelet we use for any kind of bleeding tendencies. If the bleeding is not stopped or any bleeding disorder, we give them platelet. So increase the hematocrit level, increase the hemoglobin level, define the elevated temperature, decrease the oozing of blood from punctured site or gum. So I said the platelet already mentioned on the question. And platelet we give if the patient have any kind of bleeding disorder. So out of 4, definitely 3 is not an answer. Hemoglobin, if reduced, we give them red blood cell or hemoglobin or hematocrit, but only 4, it is directly mentioning the bleeding occur from site and gums. This is the good choice. What rationale? Platelet are necessary for the proper blood clot. the client with insufficient platelet may exhibit the frank bleeding, oozing of the blood from puncture site. So bleeding tendency, if any bleeding, always platelet. Wound or mucous membrane, bleeding even from wound or mucous membrane. So this is the one. So now more information from this question. Increase the hemoglobin and hematocrit level would occur when the client has receiving transfusion of red blood cell. Elevated temperature would decline the normal after infusion of granulocyte because this cell were instrumental in fighting the infection. So definitely answer 4 is the best one. Another easy question for you, super easy. Let's see what are the most important. So this question said, the nurse has obtained a unit of blood from the blood bank and has checked the blood bank prior with another RN. So this is very important, blood transfusion. So before transfusion the blood, you must do RN, must check it. And we can take the history, patient do not have any blood transfusion reaction before. Even after the infusion, we will be with the patient next 15 minutes to check any kind of blood transfusion reaction, right? So if you do not know what are the blood transfusion reaction or sign and symptom, or if blood transfusion reaction is occur, don't go for the board exam. Okay, this area is frequently asking by NCLEX board due to some unknown reason. So they said just before beginning the transfusion, the nurse should answer which priority. It is very easy, right? Your patient is stable or not stable. How you understand your patient is stable or not stable? If the vital sign is normal, if vital sign does not fluctuating, indicate your patient are the stable. So it is easy. Vital sign, color change, urine output, and last hematocrit level. So definitely vital sign indicate the patient is stable or not. So the changing the vital sign during the transfusion from baseline may indicate that the transfusion reaction occur. And that this is why the nurse assesses the vital sign before the procedure, again after the first 15 minutes, and thereafter the per agency policies. The other option do not identify assessment that are priority of just before beginning the transfusion. It is super easy question, but it is very important, and student must have the good sense about the blood transfusion for the exam.